Good afternoon, everyone. I'm John McDonough, President and CEO of the Greater Vancouver Chamber. And I hope you were able to enjoy our virtual platform and maybe visit with some of the other folks on the webinar today. We're pleased to bring you this Mind What Matters series through the generous support of our series sponsors, Opsal Dawson and the Peak Fleet. And just a reminder that the Mind What Matters webinars are viewed by hundreds after the original streaming as we post them so that you can go back and review or encourage your employees or neighboring businesses to view it as well. Certainly, if you have an interest in becoming a series sponsor for Mind What Matters, just give us a call or send an email to yourchamber@vancouverusa.com. Thanks for joining us this afternoon. We're glad you're able to make it on what was arguably very short notice. When the Long-Term Care Act was passed this past session, it caught many by surprise, and by the time we figured out there was action necessary, the state online system was not functioning well, and private insurance providers had quit offering the coverage due to the volume of requests, making it virtually impossible to opt out if that was your choice. Today, we're fortunate to have with us an expert panel who can provide some insight as to how the Long-Term Care Act evolved, who it covers and who it does not, who has to pay and who doesn't, and what the horizon holds for the future. With us on the panel today are from the Association of Washington Business, Bob Battles. Bob's General Counsel and Government Affairs Director, and focuses mostly on workplace safety, unemployment insurance, employment law, and legal affairs. Also with us from the AWB is Amy Anderson, also a Government Affairs Director specializing in healthcare and federal issues. And joining on the panel is Kathy Quattrochi. Kathy is Benefits Account Manager with Davidson Associates Insurance here in Vancouver. And I'd like to welcome those three panelists to the stage. And for our attendees, as we go through the information today, your microphones will be muted during the presentation. Please use the chat feature. So you'll find a chat button located to the right of your screen. And when you go there, look for the general chat and put your questions in the chat. And we will have time at the end for questions. So if you want to save them and put them in the chat at that point, that's also fine. So to get us into our topic today, I'll ask our friends from the Association of Washington Business to provide a bit of background on the Long-Term Care Act to get us started. So Bob, Amy?
Great, thank you, John. Thank you for having us here and appreciate everybody in attendance. So this actually goes back to 2019 when then Representative Jenkins, now Speaker, introduced a bill to establish a long-term care program in the state of Washington. And the intent behind that was to provide a very small, limited benefit for a small group of Washingtonians. This was a group that did not have long-term care coverage, but this would provide them the opportunity to have coverage until they were able to go on to one of the government programs, such as Medicaid. It also provides a very small, limited, like wheelchair ramps, if there's just small things that needed to be taken care of, somebody who needed help, respite care, things like that. So the original intent of that was to, again, provide a benefit for a small group of people. It was meant to have a rolling opt-out process. So as soon as you purchase a long-term care product, you would be able to opt out of the state program, which would have had the effect of stimulating the long-term care market in the state of Washington. So business was supportive of this originally in 2019. What has ended up happening in the last two legislative sessions is that the legislature has put into effect a limited opt-out. So what we ended up with this year, at the beginning of the legislative session, we actually had a opt-out that would have had you purchasing your product by July 1st of 2021. We were able to negotiate that back to at least the November 1st. That was at that point, at least a limited win. Unfortunately, given what has happened with the long-term care market, I'm sure Kathy will speak more to this. still did not provide ample opportunity for people to purchase a product. So what we have right now is, again, you have to have your long-term care product in place by November 1st. You have to apply for your opt-out, starting Employment Security put their opt-out process has been up and running since October 1st. It has had some glitches. There's definitely receiving the opt-out letter once you are approved. But once you do have that opt-out letter, and that is given to your employer, you no longer have to, or you are not subject to that payroll tax. And Bob will talk more about it. But you do have to wait until you have that approval. And then once you receive that letter, you then start, you are then not subject to that tax the following quarter. So there's some logistics in there too. And again, Bob will speak to that one. But this is where we're at right now. I think probably I'll wait till the little bit further in the discussion where we can talk about where we're at currently politically with this, because we have certainly made some efforts at trying to put a stay on implementation of this, as well as trying to work with the governor and our legislature on making some changes.
Great, thanks, Amy. Bob, do you want to address who's subject to the tax and how that all is going to work?
Sure. Welcome again, and thank you again for having us. People that are subject to tax is basically anyone that gets a W-2 in the state of Washington, unless you have opted out. What the current tax is going to be is anybody gets a W-2 is going to be paying 58 cents per the premium assessment on for every $100. So basically, you're going to have for every $100 you're paying 58 cents. There is no cap on the salary. This is different than if you, as you may be familiar with Social Security, unemployment, paid family medical leave, that it has a salary cap that at some point it doesn't go above that. UI is actually quite low. Social Security and paid family medical leave matches what Social Security does, so as it goes up, but anything above that you don't pay the tax. In this case, if you make more money, you continue to pay it. The problem you have with that is that is paying on a higher salary is actually paying more than the benefit they can ever get. Because Amy might have mentioned, I think it's a lifetime benefit, one-time lifetime, $6,500. So everybody's subject to it unless you opt out. And I don't know if we can talk about opt out yet, or is that towards another question down the road here?
Yeah, I think so.
Okay, so basically that. If you have any W-2 wages, and you have to be of 18 years of age. It starts at right when you start. So
Questions on here. Does this affect those who work for Washington businesses but do not live in Washington? Unfortunately, right the way the law is written, if you work in Washington State, and as Bob mentioned, you receive a W-2 from Washington, you are subject to the tax, even if you do live in, for you all, obviously, a lot of folks, employees who are living in Oregon, and then you are not eligible to receive the benefit either, because the way it is currently written is that you have to be a Washington State resident in order to receive the benefit, and you have to actually use benefits in the state of Washington. So obviously, you all, as well as some of our folks on the east side, are struggling with this too.
I think we have.
Before we leave that, there's another question that's been put in the chat about what about Oregon employers with a location and employees in the state of Washington?
Those individuals that the location and those employees, again, if they are a good rule of thumb, if you're doing paid family medical leave, if you're subject to paid family medical leave in the state of Washington, you are subject to this tax as well. So if those employees who are in the state of Washington are paying paid, they're going to also be paying that. It's 100% employee paid fund, which is different than UI, which is 100% employer, and paid family medical leave, which is split. So all of these things exist. It's a different thing, but everybody that receives W-2 in the state of Washington is subject to this tax. Reside regardless of where even their office is. If they actually maybe do are based in Washington but do most of their work in Oregon, but still get a W-2 in Washington, and they're subject to this.
You threw a big net over it, obviously.
Yes.
Yes.
Kathy, how about walking us through a little bit of what the program's designed to cover, and then who's eligible to get the benefits? We've heard that they have to be a resident, but other than that, where's the eligibility start?
Well, like you said, you have to be a resident of Washington. Eligibility as far as the policies, that they start at about age 30 to purchase a policy here in Washington state. And the criteria is you have to have, well, it's 3 criteria that you can't do before this CARES fund kicks in, or this long-term coverage kicks in. And that would be, you know, if you have trouble bathing, feeding, or just general everyday use. So you have to have 3 items that you can't do on your own before this coverage kicks in. And that would be for the Washington CARES Act or a private insurance. But private insurance typically is 30 years and up. I have not seen anything for 18 to 30 years old for the long-term care coverage. And they do hybrid policies. So there's 2 policies that are offered. You have the standalone long-term care. And then you have what was very popular was the life insurance with a long-term care rider. And that was definitely the more popular one, because if you need the long-term care, the coverage is there. If, God forbid, you pass away of a heart attack and you don't need any long-term care, then your beneficiaries would receive that benefit. So you're not purchasing a policy with I hope I might use it. It would come to use with someone. So
Maybe this would be a good time to address what the availability of long-term care policies are in the state of Washington.
okay, so I have been the Grim Reaper the last several weeks. There are no policies. There's no availability of policies right now, unfortunately. Most of the carriers cut off new business by early to mid-August. And there was one other carrier that allowed until October 8th, but that was it too. Now, why did they do that? Why did they make this law and they cut it off? Typically, nationwide, long-term, there's on average 48,000 policies are written nationwide for long-term care. So it's not a super popular product. One carrier, just one carrier received 66,000 applications in 1 month. And they just didn't have the manpower to underwrite it, because they do underwrite it very much like a life insurance policy. They look at medical records, blah, blah, blah. So they just didn't have the manpower to process all these applications for a cutoff date, or to have these policies in place by 11/1. So by law, they can do this. They can just say, we are not accepting any more applications. We are at max limit. So that is what happened. So right now, I have people calling in daily or emailing me, and I have nowhere to go, nowhere. So hopefully you guys.
So Bob and Amy, maybe this would be a good time to get into some of the conversations that you've been having on the Hill. Obviously, some significant unintended consequences in terms of what the legislature passed, and now the reality of the marketplace. So are there remedies coming, do you think, from a legislative standpoint or rulemaking?
So let's let me jump in here for a second, Amy, if it's okay. You know, kind of going back and thinking about this, as Amy talked about initially, it was for a very limited purpose to fill this. while people want some other government program that they were going to be getting within that kind of short time period. They did not spend much time when they did this about the original benefit or the original fund. And this is why we keep seeing this back the last couple of years. The actuaries, the folks that tell you whether this fund is going to survive, are telling the commission that monitors this that the fund will fail. And in fact, just so you know, when we're talking about the Hill, they have already been told that the fund changes they've made so far will still, the fund is going to fail still. This is ironic when you think about it, that we haven't paid a single dime into the fund yet, and no one is eligible to use it until 2025, and they're already telling you it's going to fail. Have been to that. The other conversations I've had is that some ironic problems, or some problems that we talked about. You heard earlier us imply about the fact that if you of Oregon or Idaho, you cannot use this. Now, this means that even though you might be in Portland, and it's not that far to drive to Vancouver to maybe get, quote, a benefit, you cannot, because your residence is Oregon. It's not about whether you could get to the thing in Washington State, so you can't even use it. Another thing is if you retire in the next 3 years, yet you will be paying on it, you will not get this benefit, you will not be able to vest. In addition, that if you ever leave the state, regardless of what you pay, it's not portable. One of the things about paid family medical leave and UI, it's kind of been portable from employer to employer. There's a way to use this regardless of where you are. And if you were in Idaho or Oregon, you would have access to certain portions of this because it's not free. So these are the conversations we've been having with members. It's a very, very expensive plan for what you're going to get. And I think as Kathy mentioned, this is a set amount. If you were lucky enough to get a prep plan, it is likely cheaper than what you're paying into the state and getting more benefit. And based on all of the requirements of it, it's accessible today. There's not a 5-year or 4-year process before it even kicks in. It's accessible. So all of these things are what the conversations we're having with them. There is a huge concern with legislators left and right. But as again Amy mentioned, this is a sort of the pet project of the Speaker of the House in Washington State, and she is very committed to not delaying this at this point. We've done some things, and maybe I thought Amy jump in on what we've done so far and what we're seeking.
Yeah, and I think that the message out there is not that this isn't needed. We do have a long-term care issue, not only in Washington State but across the country. But this to address that. We did send a letter to the governor requesting that he convene legislative leadership to discuss stay on implementation collection of the tax, which will begin January 1st, 2022. And on that letter, we had 165 businesses, organizations, and labor unions. The labor is not subject to this. They open up their collective bargaining agreements, so it's not something that's hitting them immediately, but they are concerned enough, knowing that it will be there at some point. They're concerned with the solvency of this as well, that they signed on with us. Generally, if business and labor go to the legislature, to the governor, we get a pretty good reception. We got completely shut out and have had a slew of letters, comments, op-eds, all radio interviews from legislators stating what a good program this is. We need this. It absolutely must continue. So, moving back to how are we going to address this now in the 2022 session, there is a commission that oversees the program. They do recognize parts of this do need to be addressed. For example, employees who are working in Washington State but living in other states who are paying into this. That is one of the main concerns, the solvency of this, which becomes even more problematic from a business perspective, because you can only go up to, is it $1 on this type of a tax before it does become a constitutional issue. So if there is additional funding needed, is this going to end up being a business tax as well? We're not getting a lot of clarity, unfortunately, because as Bob mentioned, this is the Speaker's project. It's important. It is an important issue to address. This is just not the way to do it. So I know we've had a lot of you folks in Washington region providing your names and putting your names on those letters. We appreciate it. We know you've been reaching out to legislators as well. Keep it up as you hear. It's important that they hear how this policy is impacting businesses and employees around the state. We do have a couple questions. John, do you want us to answer those quickly?
And before we jump into the questions, one of the things that is important to remember that this whole thing about eligibility and the problem. This is the other thing we're hearing is we've had some very large companies in the state. Some of the largest companies in the state have been unable to get long-term care plans for their companies. And so one of the things that's happened is some of them have said, well, we've set a portal to help you go apply for your own plan. Folks were applying, but when you apply individually, as Kathy will tell you, you have to individually qualify, which means you have to meet all their requirements. And one of the things that she was stressing there was the 30-year-old, and most of them are written, if I understand, at 40. And so you can't even get it if you're 18, 20. You're not even eligible for this to opt out at 17 because you're not in the program yet. So it's too late. And so what's ended up happening is, and if you have pre-existing conditions, they weren't getting them. So you now have companies where some employees have a plan, some employees can't get a plan. And again, this whole inequity that's happening, sort of defeating the whole purpose of this. And a program that's not really portable. How many 18-year-olds can guarantee that they're going to be here when they retire to be able to use this long-term care plan? They're mostly leaving the state. So, and then we'll have to the questions.
I think Kathy.
Okay. Yeah.
Oh, I was going to say, and that's the one good thing having your own long-term care policy when they're available is it is portable. You can move to Arizona, Florida, wherever, and it's portable. This one is not. And the benefit is they base it on what, $100 a day for in-home care. And that 10 years from now, even though it's planned for inflation, that's still not going to cut it for a couple months if you have to go to a long-term care facility. So it's, I understand what they're doing, but not good.
Kathy, I know that you can't speak specifically to rates, but there is a question about the relative cost of a life insurance policy with a long-term care rider versus the cost of this program. And can you speak a little bit to that issue?
So typically, well, I can only base it on my own. On my own experience. So it is a little bit more expensive than the Washington CARES tax. So for $100,000, if somebody making $100,000, they're going to pay $580 for the year. You would typically see, and it's underwritten very much like life insurance. It's based on age, smoker, medical history. So I have seen anywhere from $100, $150 a month, and that's for maybe a $50,000 benefit, all the way up to, and I'm going to use my personal information, 53-year-old male for a $250,000 benefit, and that's $500 a month. So it really does vary. So do the costs outweigh the benefits? It's portable and you get a lot more coverage. So I say it does because, like Bob and Amy mentioned, there's no cap. If you make an incredible amount of money in 1 year, and I hope everyone does, that's all taxed. So, and it's not pre-tax. Am I correct? From what I've read, it's not. It's not. Yeah. So I would say anywhere you're looking at 100, 150, all the way up to maybe 500 or more a month, not a year. So, but it's better covered.
So there's a question from Brad Carlson, who's wondering about wages paid for sick leave or vacation. And again, as I understood what you said earlier, anything that's included in the W-2 would be subject to the tax.
If it's a W, if it's your wages, I guess like it's a 401k. It's all pre-tax.
Yeah.
Yes, it's gross.
Yeah.
And Amy, I don't know if you want to mention about timing of why I appreciate people asking about the life insurance. I'm not sure Kathy would be able to know whether there's even time to do this before the cut. You must have the other alternative insurance in place by November 1st, which I believe is Monday.
Mhm.
And there is nothing available. So somebody did ask if we don't already have a policy, there's truly no way to opt out at this point. And the answer is no, unfortunately. I feel horrible.
And what's the likelihood of a legislative fix in terms of a rolling opt-out, which was envisioned in the original bill?
Yeah, well, unfortunately, and we've gone through this process too. Can the governor, can legislative leadership do anything prior to the 2020 legislative session? We're getting the message, which means this tax goes into place January 1st. So that from at this point, the way we're understanding, the way it's written, and the messaging we're getting is we can only address this once the legislative session has started that second week of January. The tax starts to be collected first. So while we will definitely fight to get a stay on this and make those changes, the reality is that people are going to start having that tax taken out of their paycheck come January. And it's
well, currently there is no provision in the statute that allows the fund to refund any money that's already taken out. So if you don't get exemption, the opt-out before January 1st, you're eligible to apply for it all the way up to December of 2022. But for every quarter you haven't applied for it, you pay for that quarter. So if I got down on January 2nd, I still pay all the way through that first quarter, and the money comes out of my account. And it doesn't. So we are working and talking to legislators about, can we do a fix? But as Amy said, without a fix to it. Now there are some potential initiatives that are being considered, but again, that's to over functions. But it's still something that's going to either have to be run through an election or not. And those initiatives aren't going to take care of it. If that's what they rely on, will not take care of that prepaid, all that.
And to add on to what Bob was saying, opt-out piece of it, you may apply on January 2nd, but until you actually receive an approval letter from Employment Security Department, you continue to pay that tax. You may not get it till the quarter, through that second quarter as well. So the one question on here is, if you have long-term care, get onto the Walk Cares Fund website and apply for that opt-out right now. I know I did mine 2 weeks ago. I applied for mine. I have not received my letter yet. So it's incumbent to get on there. It's a bit cumbersome because you have to set up a state account like you do for paid family leave, and then you can go in to apply for your opt-out. You do not have to upload any documentation proving that you have the long-term care plan. It's basically an attestation saying that yes, you do.
And I just put the website, the walkcaresfund.wa.gov. I put that link in the chat. So anybody who has that coverage in place and wants to get on and apply for it, that's where you do it. Okay, and another question from Brad. An Oregon resident working in Washington must pay the tax, but never will have the benefit as long as they continue to live in Oregon.
That is correct.
As the way it's right now, again, the commission that oversees that is one of their key topics they're addressing. It's certainly something that we will change to should legislation come up.
Yeah, I think there's a few things that may be addressed. I don't know if it means you're going to get out of paying it this point. I suspect what you will likely see if they can correct that is that you would have access to use it, perhaps in Washington State. That's kind of where I see that going. We would ask that you be exempted out, or you always have the ability to opt out. Comes to on November 1st and get a long-term care plan because your company has it, which is one of the few ways that an 18-year-old can get it if they join a company because the company has the whole program. It's too late to opt out. Because you didn't get it in a timely manner for the date cutoff. Basically, November 1st, so let's say November 2nd to be clear. The other thing that's being considered on the Hill, because we've talking about what's happening on the Hill, is there is discussion about litigation, but it is not cut and dry on how that litigation, who would be the challenger. It's usually, again, it's not the employer, because your employer's not paying it, you're just collecting it. It's going to be employees who wants to be the face of that. And also, what kind of challenge do you do this? I think some of your strongest challenges are the things that we just talked about. Residents who can't use it, people that retire in 3 years, the inability that without the ability to use it at all. Those are some of the challenges that are being talked about. And there is discussions going on that, on how folks might engage in that litigation component as well.
I have one question about the timing. So the tax is going to begin to be collected in 2022 and can't be accessed until 2025, but to be vested, you have to pay in for 10 years. So who could access it in 2025?
So this is a piece that the commission is addressing are the short-term retirees, those who are retiring within the next 3 to 5 years. So that's, you're right, nobody, and the way it's written right now. So hopefully that is something that will be, or that is going to be addressed, is something that they're addressing.
Okay.
The other thing that's been sort of interesting here, and I think Kathy can talk about this, or maybe you might have some insight on this as well. One of the reasons why the private market has basically collapsed is not just the sheer volume, but the assurances of being able to, because they have not required you to even maintain this insurance. If you get it before November 1st, you can opt out, and then there's no requirement to. And so the companies are looking at that and saying, we've got to also deal with our actuaries. We have to make sure that the fund is worth it and that we can hold on to it. And so they've created sort of, like the way this bill is written, has created sort of the result of what's happened in the private market. It's, chicken and egg in this case. And so it's fortunate that that's happened. And so they've actually created a self-fulfilling prophecy of the collapse there. And so we have heard from the private market that if you can correct some of that, there may be some people coming back in the market. But of course, without a change in the law, when you can opt out at any time, it doesn't matter.
Yeah. Kathy, anything to add there?
Well, that is a concern. People just purchasing this product just to get their letter, and then boom, they can let it lapse, and then we're kind of back to square one again. So, saying pretty much same as Bob is saying, he's right. He's right. Yeah, it's thought was there, good thought. Execution not so good.
So, question in the chat about someone late in their career moving to the state of Washington, and would they be able to receive full benefit, though they haven't contributed for all that long?
So they'd have to vest, and I think it's within a 10-year period, if you paid into the fund for years, then you vest into
I
it.
think
So
it has to be 5 consecutive years.
Consecutive years.
Consecutive years, yes.
So yes, but if you're coming in and retiring in 3 years, the answer is no. And it doesn't matter if you come in and decide you're going to work for another 10 years and you have a long-term plan that you're carrying with you. That doesn't matter. You will pay it and subject to it. Like I said,
If you come in after December 2022.
Yeah. If you want to, if you
I think
you're
we're
hearing our
confusing it,
frustration.
yeah.
Yeah, you're hearing our frustration on this thing. So we appreciate the question. Sorry, go ahead.
So I would ask our attendees, if there are other questions, please go ahead and enter those into the chat. Amy and Bob and Kathy, thank you very much for taking the time. It's clearly a very frustrating and kind of ill-conceived bill that wound up being passed. But we appreciate your trying to make some sense of it for us.
Well, you're right. I
Okay.
just wish we had better. Wish I had better news about availability.
Hopefully we'll get some better news out of the session this January. Are any of you aware of the exemption if you plan on retiring prior to 2025?
As long as you have a long-term care plan in place by November 1st, you can apply for that exemption.
Okay, so you have to have that. Okay.
Yeah, without it, you start paying on January 1st and before 2025, but no benefit.
Okay. All right. I'm not seeing any other questions come through. So for our attendees, thank you for taking the time to learn a bit more about the Long-Term Care Act and what used to be an opt-out plan. And again, to our panelists, thank you for taking the time to share with us this afternoon.
Yeah, thank you for having us.
Okay.